Welcome to the lecture on intrinsic muscles of the back. The primary function of the intrinsic back muscles is for posture. Posture meaning that the intrinsic back muscles maintain the spine in an upright and aligned position. As we had mentioned before, the thoracolumbar fascia is a membrane actually of dense connective tissue that actually encases the intrinsic back muscles. You will see this structure in the cadavers. Because the thoracolumbar fascia is made of this dense connective tissue, it contains lots of type 1 collagen fibers. Type 1 collagen fibers resist tensile forces. So it gives it good postural strength, but also this does not stretch very well. So when you are doing stretching of the low back, it's important to stretch slowly and carefully as to not to damage the fascia. When learning the intrinsic back muscles, we will divide these muscles up into groups. The erector spinae, also known as the paraspinals, the spinotransversae muscles, the transversospinae muscles, and the suboccipital triangle muscles. These muscle groups are named primarily from the inferior attachment to the superior attachment. When learning about and thinking about the actions of these muscles, the inferior attachment is the fixed attachment. When learning the function of the intrinsic back muscles, it's important to think about the fiber direction as this will dictate its function. Fibers that run in a superior lateral direction will rotate the vertebral column to the same side. So, if you have a muscle that is attached inferiorly at the spinous process of C2, and it courses superior lateral to the transverse process of C1, this muscle will rotate the vertebral column to the same side. Whereas fibers that run in a superior medial direction will rotate the vertebral column to the opposite side. So now picture if you have a muscle that is attached to the transverse process of C4 that courses superior medially to C3, this muscle will rotate the vertebral column in the opposite direction or to the opposite side. Rotation, of course, occurs when you have a unilateral contraction of the muscle, or in other words, when there's only contraction of one side of the spinal column. Of course, the muscles in the spinal column are paired, so of course you have a right side and a left side. So when you look at these muscles, if they form a V, you have a muscle that will rotate the vertebral column to the same side. Whereas if you look at these muscles bilaterally and the muscles form a roof, these muscles, when they contract unilaterally, will rotate the vertebral column to the opposite side. Let's proceed into talking about the groups of muscles and their actions, and perhaps it'll become a little bit clearer. So the first group I'd like to talk about is the erector spinae muscles, also known as the paraspinals. These muscles are divided into three groups: spinalis, longissimus, and iliocostalis. The attachments of spinalis are between the spinous processes of the lumbar region all the way through the spinous processes of C2. The capitis portion, or the cervical portion of spinalis, is actually considered part of the semispinalis muscle. The semispinalis is one of the 4 transversospinae muscles that we will cover shortly. Longissimus is attached between the transverse processes in the lumbar region through the cervical region, and is also attached to the tubercles of the ribs and the mastoid process of the skull. Iliocostalis' attachments are to the posterior iliac crest and the sacrum, all of the ribs, and the transverse processes of the mid to lower cervical spine, C4 through C6. In the cadaver lab, you will see the erector spinae muscles to be more superficial to the spinotransversae, the transversospinae, and the suboccipital triangle muscles. Also, when you're looking at the cadavers or when you're studying the erector spinae muscles, the spinalis muscles lie more medial to longissimus, and longissimus lies more medial to iliocostalis. So when you're moving from the midline of the body outward, you will see spinalis first, longissimus more lateral, and the lateral to that iliocostalis. The movements that occur at the intervertebral joints are extension, side bending, also known as lateral flexion or abduction. All of the erector spinae muscles do side bending, but there is some controversy whether spinalis has much of a contribution to side bending. They also produce rotation to the same side. This is done through iliocostalis and capitis or cervical portion only of longissimus. The erector spinae muscles also produce anterior pelvic tilt in the closed chain hip movement. The erector spinae muscles receive their innervation through the dorsal rami of the spinal nerves. Using the arrows and the color coding as a guide, see if you can draw in the spinalis, longissimus, and iliocostalis muscles. Spinalis is indicated in red, longissimus in blue, and iliocostalis in purple. Compare your drawing to mine. The spinotransversae muscles are divided into 2 muscles, the splenius cervicis and the splenius capitis. As the name indicates, these muscle attachments will be from the spinous process inferiorly to a transverse process superiorly. This forms that V fiber orientation, which will then indicate to you that these muscles will do rotation to the same side in the vertebral column. The attachments of splenius cervicis are the spinous processes of T3 to T6, that is the inferior attachment. Its superior attachment is the transverse processes of C1 through C3, and sometimes C4. Splenocapitis attachments is the inferior attachment of the spinous processes of C7 through T3, and this muscle will course superior laterally to the mastoid process and the superior nuchal line of the occiput. Co-contraction of the spinotransversae muscles will produce intervertebral joint extension, whereas unilateral contraction of these muscles will produce intervertebral joint side bending and rotation to the same side. The innervation of the spinal transversae muscles is the dorsal rami of the spinal nerves. Go ahead and label the muscle attachments and draw in the muscle. Splenius capitis will be in blue, whereas splenius cervicis will be in red. Once again, how does your drawing compare to mine? The transversospinae muscles are divided into 4 muscles: semispinalis, multifidus, the long rotators, and the short rotators. As the name indicates, the transversospinae muscles will originate inferiorly at the transverse process and course medial superiorly to the spinous process, forming a roof. The roof, therefore, indicates that the movement that the transversospinae muscles will do will be rotation to the opposite side. The semispinalis is found in the cervical and thoracic regions. In the cervical region, it attaches to the skull or the head. The inferior attachment of spinalis is the transverse processes of T10 through C4, and the superior attachment is the spinous processes of C7 through C2, as well as the occipital bone. Typically, the semispinalis muscle fibers will cross an average of 4 to 8 vertebrae between the inferior and superior attachments. The multifidus is found in all regions from the cervical spine all the way down to the sacrum. Note, though, that the multifidus does not have an attachment to the head or the skull. The inferior attachment of multifidus is the posterior superior iliac spine of the pelvis and the transverse processes of the sacrum, whereas the superior attachments are the spinous processes of L4 through C2. The multifidus muscle crosses an average of 2 to 4 vertebrae between inferior and the superior attachments. Now let's talk about the long and short rotators. The long rotators span over 2 vertebrae. Their inferior attachment is the transverse processes at all the vertebral levels, whereas the superior attachment is the spinous processes of all the vertebral levels to C2. The short rotators span over only 1 vertebra. The inferior attachment is the transverse processes of all the vertebral levels, whereas the superior attachment is the spinous processes, again of all the vertebral levels, to C2. The movements of the transversospinae muscles at the intervertebral joints are extension, side bending, and rotation to the opposite side. The innervation of the transversospinae muscles is the dorsal rami of the spinal nerves. In this diagram, go ahead and draw in the semispinalis with its attachments in the cervical and thoracic regions. Remember that the fibers of this muscle, semispinalis, cross over an average of 4 to 8 vertebrae. How does your drawing compare to mine? In this diagram, go ahead and draw in the multifidus, the long rotators, and the short rotators. Remember that the fibers of the multifidus cross over 2 to 4 vertebrae from the inferior to superior attachment, whereas the long rotators, indicated in purple, cross over 1 vertebral level from inferior to superior attachment, and the short rotators indicated in blue cover 2 vertebral segments from the inferior to the superior attachments. How does your drawing compare to mine? Notice if you were to draw the muscles in on both sides of the spinal column, they would form that roof shape. Remember that the roof shape indicates to us that the muscle will perform rotation to the opposite side. The last group of back intrinsic muscles we'd like to cover are the suboccipital triangle muscles. These are divided into 4 muscles: the rectus capitis posterior major, also known as rectus major; rectus capitis posterior minor, also known as rectus minor; obliquus capitis superior, also known as superior oblique; and obliquus capitis inferior, also known as inferior oblique. The rectus capitis posterior major's inferior attachment is the spinous process of C2. Its superior attachment is the occipital bone. Rectus capitis posterior minor's inferior attachment is the posterior aspect of C1, and its superior attachment is the occipital bone. Obliquus capitis superior's inferior attachment is the transverse process of C1, and its superior attachment is the occipital bone. Obliquus capitis inferior's inferior attachment is the spinous process of C2, and its superior attachment is the transverse process of C1. The suboccipital triangle muscles produce movement at the cervical intervertebral joints. They produce extension, side bending, and rotation to the same side. Rectus major produces extension at the AO and AA joints. Rectus minor and superior oblique produce extension at the AO joint, whereas inferior oblique produces extension at the AA joint. Superior oblique will produce side bending at the AO joint. It is controversial whether there is enough power generated by the rectus major and rectus minor to perform sufficient side bending at the AO joint. Rotation to the same side occurs at the AA joint through contraction of the rectus major and inferior oblique muscles. The innervation of the suboccipital triangle muscles is dorsal ramus C1. Go ahead and draw in the muscles: rectus capitis posterior major in blue, rectus capitis posterior minor in purple, obliquus capitis superior in red, obliquus capitis inferior in yellow. How does your drawing compare to mine?